Hello, it's good to have you again. Your health, your life. Today we're going to be talking about a lumbar puncture. Most people have an idea what a lumbar puncture is, and most people are afraid of having a lumbar puncture done on them or any of their relatives. There have been a lot of associations and fears in the community about what a lumbar puncture really does to somebody. Somebody saying a lumbar puncture would mean death. Others would think a lumbar puncture would result in madness of somebody. Others would just think if a lumbar puncture is done, it simply means that the chances of survival, of regaining of full function are severely compromised. But for us to elevate those fears, we need to understand a few things first. What really is a lumbar puncture? Well, a lumbar puncture is a hospital procedure that is done. It's usually done by medical doctors. And what it involves getting a small sample from the fluid that runs around your brain. This fluid is called cerebrospinal fluid. You see, this fluid not only runs around your brain, but it also runs around your spinal cord. And doctors are able to get a sample of this fluid from your back along the vertebral bones, just the bones at your back. You know those vertebrae that are usually prominent when you bend over? Yes. So just along those bones, lower down, doctors are able to insert a needle and then collect a bit of that cerebrospinal fluid, which we'll just be calling fluid for simplicity's sake. What is the role of this fluid in the brain? Well, this fluid is there to cushion the brain. It acts as a shock absorber. Can you imagine how many times you've hit your head to the door, to the wall, or for some of you, how many times you've been punched in the head? Your brain still works because you have that cushion that absorbs all that force and keeps your brain safe. Because this fluid is intimate to the brain, it's in close contact to the brain, any infection in the brain will also result in manifestations or in detection in the same fluid because they're so close to each other. So for instance, if somebody gets a germ that infects their brain and gives them an infection, this germ can easily be seen under a microscope using the cerebrospinal fluid, using the fluid. And that is the reason why doctors need a sample of that fluid so that they may know exactly what is wrong with somebody who comes with a brain infection or other types of brain diseases. Now, a brain disease is very dangerous. You see, the brain is the boss. It controls everything. So if the brain is sick, if the brain has significant infection, it is something very serious. And some people do not make it if they have brain disease. It's not as simple as malaria or other diseases like a UTI and TB and pneumonia like we have discussed in the past. This is serious. And in most cases, some patients may die not because of the lumbar puncture. Some patients may end up being disabled not because of a lumbar puncture. Some patients may end up not being completely normal after the infection, not because of the lumbar puncture, but because of the disease state itself. The lumbar puncture itself is safe, especially it is done by qualified medical personnel in a controlled situation or environment like a hospital. Of course, a lumbar puncture is not always safe for all diseases, and doctors are skilled enough to know when and when not to do a lumbar puncture. And if that is the case, they may recommend for you to do other tests where they would like to see images or pictures of your brain by doing x-rays of your head, advanced x-rays that we may call a CT scan or an MRI scan. So for the doctors to know what is wrong with you, in most cases, if you have a brain disease, they need the lumbar puncture. Without it, it's like they are going to war without a gun, and that would be a difficult war to win. So what is your role as a person listening to this video? All we are asking is that you help spread this message. If you happen to be amongst those people that people call for guidance each time they are offered a lumbar puncture and they need an opinion from somebody like you, be there to help them understand that a lumbar puncture is safe. Because the doctor's first responsibility to the patient is do no harm. So they wouldn't suggest anything that is harmful to the patient. So spread this message. If you like the content of this video, kindly subscribe to our channel on YouTube and press the notification button so that you may be kept abreast of any new video that we may post. Your health, your life. Thank you very much for listening and have a lovely day.